Poor health contributes to and is the result of poverty. Despite decades of progress, there is still an unacceptable level of deaths from preventable illnesses in developing countries. Malaria kills over 1 million people every year. The increase in TB, mainly as a consequence of HIV infection, accounts for 2 million deaths annually. Children in the poorest countries are particularly vulnerable to disease. Many of the diseases that are no longer a threat to children in Ireland continue to cause the deaths of children in developing countries. Each year, almost 9.2 million children die before the age of 5. That is approximately 26,000 children every day. Healthcare, including responding to HIV and AIDS, accounts for over 23% of Ireland's overseas development budget. By working in partnership with governments, other international donors and development agencies, Irish Aid is achieving real progress in improving people's health in developing countries. With Irish Aid's support, over 18 million mosquito nets have been distributed in Ethiopia since 2005, reducing new malaria cases by 53%. 50,000 pregnant women received drugs to prevent transmission of HIV to their unborn children in 2008. The number of rural health posts in Ethiopia rose from 1,400 in 2001 to almost 10,000 in 2008. In the mountainous southern African country of Lesotho, which has the third highest HIV prevalence rate in the world, Irish Aid is supporting government clinics which provide vital health services to remote mountain communities. Many patients arrive with HIV-related illnesses. Dr. Sean Scott, an Irish citizen raised in Australia, is working with his colleagues from Lesotho to provide general health services and HIV treatment to the local population.
Together with the Ministry of Health, we identified 9 health centres in the mountains of Lesotho that were most in need of help, particularly in terms of rolling out HIV treatment for the extremely high prevalence of HIV in this country. About a year ago, the funeral director at Nohana had to close his business. He was packing up and moving elsewhere where he could find more business. So the rate of death from HIV has dropped dramatically because basically once you get a person onto antiretroviral treatment for HIV, they can live a normal, healthy life, and the lifespan for someone on this treatment has not yet been determined. The Rural Initiative project here in Lesotho is funded in a large part by Irish Aid. As far as value for money, I don't think you can even put a price on what you are doing.